Just one day after the president announced his plans to begin reopening the country, Arizona is seeing a big jump in the number of cases of coronavirus. And Brandon, now lawmakers say our state is not close to being ready.
Yeah, that's what a lot of lawmakers are saying. Let's take a closer look at some of the numbers here in the state of Arizona. Right now, we have more than 4,500 cases in our state. The total number of deaths, that is now at 169. 19 people have died yesterday from coronavirus, now making it the biggest one-day jump in our state that we have seen so far. But our investigative team has been looking into how the state counts those cases, and we found the actual number of deaths is likely to be much higher. Our chief investigative reporter, Morgan Lowe, joining us live with that story tonight. Morgan.
Yeah, Brandon, the problem we found is that there's no statewide uniform system for identifying and then testing people who died outside of a medical environment, like people who have died at home. Phoenix firefighter paramedics respond to roughly 4 adult dead body calls every day. And in most of those cases, the death is deemed to be from natural causes. So the body goes straight to a funeral home. But this week, Phoenix Fire began taking an extra step, asking more questions meant to identify whether the deceased might have had an undiagnosed case of coronavirus. This is part of a policy change made by the Maricopa County Medical Examiner on March 17th, meant to identify people who died of coronavirus outside of a medical setting. To date, the ME's office has tested 7 bodies as a result of this policy. But across the valley and across the state, we found inconsistencies in how and if these cases are reported or tested at all. State law requires first responders to notify a medical examiner if a death is suspected to be caused by a previously unreported or undiagnosed disease that constitutes a threat to public safety. But some COVID patients die of heart attacks or don't show symptoms at all. And those are the cases that are most likely to fall through the cracks, according to public health experts contacted by CBS 5 Investigates. And counties across the state have different policies. We even found police and fire departments in the valley responding differently. But more and more people do appear to be dying at home. According to an analysis of Phoenix Police Service calls, officers responded to 120 dead body calls in February, 155 in March, and April is on track to reach 190. Here's why this is important. If you don't know who is dying of COVID-19 and where, you're not going to be able to track where the hot spots are. And the public health experts we spoke to said that is going to be key to containing this virus. Brandon?
Yeah, Morgan, you showed those figures in the increase of deaths that Phoenix police are now responding to, but is there any way to tell how many of them, if any, are related to the coronavirus?
Yeah, without testing all of them, you can't. But this is taking place, this trend in other metropolitan areas. And there are a couple of theories. And one of them is that some of them may be dying of coronavirus, but others may have some other health problem and they're not going to the hospital or going to the doctor because they're afraid of getting sick, and then they end up dying at home. Brandon, back to you guys.
And that is our chief investigative reporter, Morgan Lowe, reporting tonight. Morgan, as always, thank you.